everybody. Thank you so much for joining us today for this little free webinar with Dr. Teresa Irwin, who likes to be called the Vaginacologist now. So maybe let's talk about that a little bit, because it's definitely not a term you hear in normal conversation.
Well, I think it gives you an idea of what I do, but that's exactly why I use it, because really, officially, I'm a female pelvic medicine reconstructive surgeon. You know what that means?
I know it's a mouthful.
It's ridiculous. So our college decided to change our original title, which is a urogynecologist, which even then is somewhat understandable, but not real clear. And then
not to the layman.
we got a more unclear title. So I took the idea from our son. And while he was in high school, one of his buddies came up to him and said, "Hey dude, what is it that your mom does for a living?" And he's like, he's 15, 16 years old. He's heard me talk about penises, vaginas all day long. And so he's like, vaginacology? And so when he told me the story, I was like, oh my God, that's exactly what I do. I take care of problems in the vagina. And therefore, that's how that term came along.
That's the best. Yeah, there's no way that a teenage boy is going to remember female pelvic medicine reconstructive surgery.
No.
But no, that's so great. So how did the idea for the Vaginacologist get started?
Well, it came down to what I was seeing over and over again in the office, which was problems in the vagina. So things such as loss of bladder control, loss of bowel control, loss of sexual function, sagging vaginas. There are medical terms to that, but I feel like it's a little more understandable that way. Anyway, a lot of the common things that can prevent these conditions from occurring can be implemented preventatively early, so that patients don't develop these problems, because a lot of it is prevention. Of course, we're not going to be able to prevent everything, but
right.
The majority can, or they can be not so magnified. They don't have to be as severe as to the point that I see them. As my title says, I'm a reconstructive surgeon, so I do a fair amount of surgery, and I'm working on the goal of getting myself out of a job, so I don't want to do as much surgery anymore. No. I feel that, yes, we have great procedures that we provide patients, and they make a lot of difference in their quality of life, but the problem is it's not really as necessary if women had the early education on what they can do to prevent it. And
yeah, it's almost like treating it's not as effective to treat something after it's already happened.
Right.
It's like if we can prevent that damage and prevent those symptoms, that's way better than just kind of trying to fix what's been broken.
Oh, absolutely, no question. And the more, for example, I have a lot of complicated cases, so I'm not necessarily doing their first surgery for the condition they have.
Oh, wow.
It may be the second or the third, and with each subsequent surgery, it becomes more difficult. Not just for me, but for the patient. They don't have as great of a result as they would have if they had the first surgery done. So, even if we could do that, just simply prevent the repeat surgeries, that's even another value.
Yeah, how common is it to see people who need multiple surgeries?
Well, unfortunately, it's common. What percentage, I can't tell you, but it's definitely more common than you would expect. You would think that, you have this problem, you go get surgery, it's fixed, right? But here's the issue, and that's the other part of what makes this education so important, is because, and I love to use this analogy, and that is, if a patient goes in for bariatric surgery, well, then they lose 100 pounds, let's say, and all of a sudden, they go back to their old ways, they stop exercising or not as much, and they eat all the high carb foods, and on. What happens?
They gain the weight back.
Right. So it's not quite to that degree when it comes to, for example, treating the sagging vagina, which is prolapse, so things are starting to draw up in the vagina, or incontinence, so the uncontrollable leakage of urine. And if I do a surgical treatment, and they go back to their old ways, well, they have a risk of having some of that recurrent incontinence or prolapse happen.
Yeah, even like I also feel like if you know you get surgery and maybe you know it's hard for a surgeon to in the post-op appointment be like, here's everything you were never taught throughout your whole entire life.
Mm-hmm.
I feel like that's just unrealistic, so you really gotta have a whole separate system of education.
Oh yeah, no question. And I'm really thankful for the pelvic floor therapist that I send my patients to. And in the beginning, I always recommended it. I didn't make it a requirement. And so now I do, because if they come to see me and let's say, you know, they failed non-surgical treatments and now they want surgery. Well, I will not operate on them unless they have gone to see a therapist and learned those basic things that you can do to keep it from recurring once I operate on them.
Wow.
And, you know, I didn't do that in the beginning, but what I realized is that the patients that did the best, because I see them every year to make sure they're still doing well, make sure there's no problems, and the ones that didn't have recurrences were the ones that did all the things that the therapist taught them. And I thought, you know, this whole time, yeah,
imagine that.
The crazy, you know, I thought, you know, I'm the surgeon. I did this great surgery on them. It should be all the things that I did that makes it so great, but it's not. It's what the therapists have taught them. They stole my thunder, you know. So I'm stealing their thunder and I'm teaching all the things that they teach.
Okay, so let's get into some examples of what like your pelvic floor therapist would teach you or would want you to know.
Okay. Well, there's a lot. But one of the
Whoops, I asked a big question.
We'll start with the most common one, and that's Kegel exercises. And you've probably heard of Kegels, right?
Nope, I don't talk to you at all. I don't know you at all.
So most people have heard of Kegels. The problem is they do it incorrectly. And I cannot tell you, I would say at least 9 out of 10 patients do not do them correctly.
Knowing what they are now, I will say for sure that most women are taught wrong. Because all throughout high school, you know, sometimes, not all the time, you'll hear people be like, oh, do your Kegels, and then it's like, what is that? And it's like, hold your pee. There's no, like, do you hold it forever? For how long? Like,
never pee again.
Yeah, literally. It's so strange, but, okay, so what are Kegels?
Okay. So going back to that point that you just made, and then I'll step into the instruction on it. A lot of people think, not just holding their pee, they think that they're supposed to do that when they're sitting on the toilet. Like hold it in
like when you're
midstream,
actually peeing?
Like pee and then hold it, stop their stream. That's how a lot of women come back and tell me that they thought that that's how to do it, right? And that's even worse because now you're training your bladder and your brain to think that that's how you're supposed to do it. So after you do that often enough, you can't empty properly because it's used to stopping the stream.
So it'll stop even without you trying?
Mm-hmm.
Oh.
Now it may not like completely shut off, but it may just dribble instead of a normal stream. So it's interesting how the brain and bladder work, you know, together and sometimes not together. So
the vagina has a mind of its own.
Yeah, it does.
I love it.
So, you know, it's like a child when we teach them to behave, right? We do certain things so that they behave properly, and that's what we need to do to our bladder. We need to teach it to behave properly, not stop our stream in the middle of trying to pee. So, okay, Kegels. Now that I went off on a tangent. Kegel exercise, the best way or the most effective type is to actually, instead of holding your pee, hold your poop, right? So you want to squeeze your anal sphincter.
Very charming. Love to hear it.
I wish I had my pelvic model, Tina, because it will, when I show the number of muscles and how big the muscles around the anus are, it becomes very obvious why it's more effective. So when you squeeze your anal sphincter and hold your poop, you're actually incorporating 70% of your pelvic floor muscles, so that's why you're getting more strength that way.
Like it's a better exercise because it targets more muscles.
Exactly. Perfect. You said it so nicely. Okay, look at me go. So the way I usually teach patients is or people in general, is pretend like you're on an elevator and you start on the ground floor, and then you're gonna go up to the 10th floor. But when you squeeze, you're gonna squeeze
That's
just
a lot of
little
floors.
bit. It is, but you can train yourself to do that, and it becomes almost second nature when you're doing it. It's no longer difficult, but it's in the beginning. It is probably going to be. So you want to start with squeezing a little bit on the first floor, go to the second floor, squeeze a little bit more, third floor a little bit more until you get to the 10th floor, and then guess what? Hold it. Hold it for 10 seconds if you can. Now a lot of people can't do that in the beginning, and so you just over time you'll be able to. So just hold it as long as you can, and then go down the elevator to the first floor over 5 seconds.
So it's basically like a gradual squeeze, like starting with the lowest and then the most, and then just trying to hold your strongest squeeze for as long as you can.
Yep, there you go again, explaining it better.
So how many times should you do that?
So it varies. Ideally, if you can do it, 3 times minimum. If you can do 10, even
like a
better.
day?
Uh-huh.
Okay.
Now, that's for someone that does not have a problem. So 3 times is good if you don't have a problem.
Like as prevention?
Yeah.
Okay.
Now, if you actually have a problem, then at least for 6 months, you want to actually do it 3 times a day. Yeah. It's
like meals. It's like breakfast, lunch, and dinner.
Yeah, pretty much. And there's an app that's really great that the therapist will have patients download, and it sends them little alerts. And you track, when you're doing it, etc. So it's a nice way to keep track of it.
Yeah.
If you listen to your alerts.
Dismiss.
So and that happens. I have patients. They're like, and they're really good in the beginning. They're like, oh yeah, I kind of have gotten out of the pattern. I say, well, do you get your alerts? Or it's like, yeah, but I'm ignoring them. So
you need like a stronger alert sound, like a can't ignore that.
So what happens, we do that a lot. We're very tuned to listening to certain alerts at the beginning, but then over time we start to ignore them.
Right, we just get accustomed to it.
So what I usually recommend is to think of a habit. So of course we know a habit is something that you do unconsciously, without thinking about it, you just do it. And then you take that habit and associate it to the Kegel. So for example, I use brushing my teeth. Whenever I brush my teeth, I know it's time to do my Kegels. And I usually brush my teeth every day. But at least that gets it.
You're really exposing yourself right now.
Oh, I'm not supposed to? Anyway, so that becomes my way of making sure at least I do it a couple times a day or once a day.
It's like a memory trigger. So if you can, I think it takes like 3 months to build a habit or something.
I don't know.
I think. But
You probably know more than I do on that one.
But basically, I feel like if you can just kind of hunker down and really do it every time you brush your teeth for 3 months, then by the end of it, you'll be like, wow, I don't even...
You don't think about it.
Yeah, you just do it.
Oh. I do believe it's 3 to 6 months, so yeah, somewhere in there. Now that I went back to my old memory files. Anyway.
So I know there's 2 types of Kegels, correct?
Well, as a general rule, yes.
Okay.
Correct. So the other one is fast twitch muscle exercises. So the first one where you did the elevator, that's slow twitch muscle fibers, and that's the 70% of your pelvic floor muscles. The fast twitch muscle fibers are the ones that cover the 30% of the strength, and you are going to be able to get those stronger by doing the squeeze like you're trying to hold your pee in, so squeezing the urethra now, which
but
is the
not
pee
when
hole.
you're actually peeing.
Right.
Okay.
So don't do it when you're peeing, because then you can get off onto another problem. And I should say the pelvic floor therapists call them quick flicks. So basically, instead of going slow, you're going to do the fast muscle fiber exercise so squeeze your urethra, and you just do it quickly as you can.
So it's not the elevator, it's like the stairs. You're not going up, you're like, dum, dum, dum.
Yeah, there you go. Well, you go fast. I need to.
You said quick!
You go fast up the elevator, the stairs.
Well, yeah, you gotta kind of book it.
But yeah, no, that's good. Yeah, now the elevator is pretty slow. Okay, so those are the 2 major ones, and how you do them in terms of, you should do it daily also. And you can do 1 set. Ideally, you want to do 10 sets of 10. So 1, 2, 3, 4, up to 10, and that's 1 set. And then 10 of those. So it's not that much, but
it's a lot when you say it, but I know when you do it, it's probably not that much.
Right. It does sound pretty intense in terms of the amounts. But if you're preventing, again, 3 times is plenty. Even once is plenty.
Yeah. I wish there was like a little badge, like, I did my 100 Kegels today.
That's awesome.
Check mark.
Get a little award, right? You get those awards on certain apps. The therapist that I work with a lot, she has a badge that has squeeze before you sneeze.
Oh my gosh, I love it. So what does that mean?
Oh, I shouldn't have said it. So exactly that. So you're gonna squeeze, and it doesn't matter if it's the urethra or the anal sphincter. Ideally, the anal sphincter. But anytime you're gonna do anything that puts pressure, exerts pressure onto the pelvis, you squeeze to prevent a lot of that pressure and potential damage over time. So if you're gonna sneeze, because every time you sneeze, cough, laugh, lift, exercise, or have especially jumping, that's a big one, then that's gonna immediately send pounding forces to the pelvic floor. So if you squeeze before you do it, then you're gonna way reduce that pressure that's there.
So the way I understand it is like the pelvic floor is a net that pretty much it lines your pelvic bone and it holds all of your organs in. So one way that you kind of just triggered like a visualization is like, you know, if you have a ton of weight, all of the sudden there's a greater likelihood that the net is going to fray or break. So.
Correct.
Right.
And actually, I do have Tina.
Hello, everybody. So we decided to go ahead and bring our third guest, Tina, so that we could kind of show y'all what we're talking about, because before I had seen the physical pelvic floor, I kind of knew what it was, but I didn't really. So if you want to take it away and just show us, when we say the pelvic floor is like a net, like what does that mean?
Sure.
What does it look like?
Okay, well, I'm going to go ahead. I guess you can see the bottom part first, and then I'll show you the inside. So it's like a bowl. These muscles that are all inside of the bone here is like a bowl of a bunch of muscles. And earlier, remember I was talking about, here's the anus opening. You can see how many muscles there are around it. It just...
So when you say anal sphincter, you're talking about basically all of these muscles, right?
So the sphincter is this part, just the round part, and there's an internal and external, and then all of these muscles, there's a bunch of different muscles with different names, but these all get pulled and squeezed when you squeeze your sphincter because they're attached.
Oh, okay.
They're attached to it. But see, if you look at the urethra, let's see, here, there's not much in terms of muscles
around it. Yeah, there's like a little bit surrounding it.
I mean, there's some back in there, but it's not a lot. Way less than here. So you can see why there's such a difference. Okay, now I'm going to have to do a hysterectomy on Tina. So,
but these are all the
vaginectomy.
Organs.
That's a hysterectomy, and that's the vagina, vaginectomy. And then take a bladder out, which is a cystectomy, and the rectum out. Colon resection, rectal resection. Okay, so you see this bowl. All of these muscles are part of the pelvic floor. So you can see how much it does create that netting and that bowl.
Yeah, it really, and then like, just as like a visualization, like all of the organs, this is the very wrong order, but they're all right there. So this is really what's preventing and keeping everything in its proper place.
Yep, exactly. So if you can reduce pressure and tension on there, then you will prevent a lot of the conditions that I treat. So, yes, very cool. And also, actually, one thing I do want to point out while we have Tina here, and that is if you look at how close these organs are, so you can see that the bladder is here, here's the uterus, and the vagina is right there, and then, I got this, yeah, it goes like this, and then there's the
Tilt it
rectum.
a little bit up.
So, yeah, thank you.
It's so squished.
So they're all tightly close together. That's why the bladder has such a propensity to then start to drop into the vagina as well as the rectum, because there's very little space. So,
Right, yeah, because, okay, if we take the bladder out,
mhm.
whoop, oh,
I know.
it's stuck in there. All right, so it
So-
literally sits right on top of the vagina.
And the rectum right behind it.
Yeah, so one thing, I forget when you explained this to me, but when you're thinking about the way that all of your organs kind of interact, if you have, you know, a dysfunction in your vagina, it's going to impact your bladder. If you have an overdistended bladder, if your bladder is too full, it's going to affect your vagina. If you're constipated, it's going to, like, everything is just so tightly packed that any dysfunction in one thing can be impacted.
Absolutely, and a lot of people don't realize that. So, for example, if someone's constipated and their rectum is full and distended, some women will start to leak urine, and all we did, like, and let's say, you know, done the workup, and then we figure out that it's constipation, and as soon as she eliminates, she stops leaking, and it was such a simple thing to treat. Yeah, crazy, huh?
Go get some fiber.
Absolutely.
But yeah, it's crazy because you may have symptoms. Like if your symptom is you leak some urine, then you're like, oh, there's a problem in my bladder.
Right.
But in reality, it may be somewhere completely different that's just manifesting. The problem is manifesting in the bladder.
Yeah,
That's crazy.
and other things. So, for example, let's say there's an ovarian cyst, a mass, or the uterus is enlarged because there's fibroids. Those are benign, smooth muscle tumors that grow on the uterus that are super common. Anyway, those can, because they're bulky, they can start putting pressure onto the bladder. And a lot of our patients that do have big uteri with fibroids, as soon as they either have the fibroids removed or the uterus removed, all of a sudden they stop leaking because it's no longer
putting that pressure. Wow.
Yeah. So a lot of things that don't seem intuitive, but once you look at the anatomy, it's like, oh yeah, okay.
Like, of course that makes sense.
Yeah. But when you just hear words, it's like, okay.
It's hard to actually visualize what they're saying.
Yeah.
But yeah.
So it's pretty cool. The female anatomy is amazing. To think that the uterus that normally is about the size of our fist can end up growing to be this big to carry a baby, and then it shrinks back down.
Yeah, that's wild.
Wild. It really is amazing.
Superpowers. Okay, do we want to talk about, do we want to go a little bit into female anatomy? Because I know there's some misconceptions or just confusion about what is the vagina.
Yeah.
So help us, vaginacologist, what's the vagina?
Absolutely. That is definitely one of the biggest misconceptions. Is almost everyone thinks that the vagina is, you know, down there. And what they're really alluding to is the vulva. So the vulva is the exterior to the vagina. I'm going to take her uterus out again. I'm doing a double hysterectomy. Maybe I can charge twice. So anyway, the vagina is actually just the tube that I had taken out, which is this here. And so that's just the opening to, what you see externally is just the opening to the vagina. So the vulva is everything outside. And then, you know, there's all the different structures on the outside. Just to name the more common ones, you have the labia minora, and then the labia majora. So the inner lips is minora, outer lips majora. And then you have the clitoris, and the clitoris glands, it has 3 parts, but the glands comes up this way, so kind of like the penis, the shaft. And then you have the legs, which here is the leg of, can you see that on their camera?
I think so.
The leg of
So that's all part of the clitoris?
Yeah, actually.
Wow.
Yeah, the full clitoris had not been discovered until 2005. Before that, yeah, isn't that crazy? Yeah,
that was not that long ago.
I know, when I trained, we did not know that. So it's interesting how that has evolved. So urologist is the one that discovered the final part, which is actually this blue part here, which is the vestibular bulbs. And anyway, yeah, it's interesting how female anatomy is being uncovered, literally.
Still.
Yeah, totally.
Okay, so
And
the only part that you
I
can
forgot.
see is the.
I had forgotten to say the whole thing.
Oh,
I
okay.
was just going to show the perineum, so the area between the vagina and the anal opening, and then of course the anal opening there, and the sphincter. You see the muscle here, of course, which is usually covered by skin. Okay, sorry.
So what is the part that you can see?
The part that you can see is the minora, the majora. So this part is covered here, and then you can see if you open up the labia, and not as in putting in a speculum, but if you just pull the labia apart, you can see the urethra. And if the patient has skin over the clitoris, we call it the clitoral hood, then you can pull that back and reveal the clitoris. And
And then you can see the
whole
vaginal opening, but not the vagina.
Right. You need to actually put a tool, speculum, to be able to see inside.
Wow.
So yeah, that's the part that gets confusing. I have a lot of patients that say, oh, I have, itching, I have vaginal itching. And when I get to finally do their exam, I say, please point to where you're having this itching. And they almost always point to the outside. So they're not
To the
really,
labia.
they're pointing to any part of the vulva. So it's vulvar itching, not vaginal itching, but we're just so used to using that word for everything down there.
Which can, it's definitely a problem when you're trying to communicate what's happening with your body.
Yeah.
But if you don't even know what structures make up your
Exactly.
body, then how can you get effective treatment for that problem? So
Yeah, we're not a simple thing like that, we're not taught,
I mean, we didn't even know about
I
it until
know.
2005.
But since then, it's still not being taught.
Absolutely, it's crazy.
And a lot of the things that the therapists will teach patients when they come back to see me, they're like, I never knew any of that. No one ever taught me. How come I wasn't taught how to sit on the toilet properly? I mean, just so many things.
Yep.
Or how to do a Kegel correctly. So it has really come a long way in terms of what we teach our patients, but those are the ones that already have a problem.
Right.
And that's where I'm trying to educate so that they don't have to come see the doctor when the problem has happened,
Right.
but rather just routine maintenance care.
Yeah. And if we're going to go into the pee positions, I will admit I had no idea that there was multiple ways for women to pee. That was a completely foreign concept until we went through literally all of them. So let's talk
You want
about
to practice here? Is that?
I already went. But let's go ahead and just tell us about it. Tell us what's wrong with it, and then a simple adjustment that they can make.
Okay. Well, when I first asked you about how do you sit on the toilet, what did you do?
I think I literally, just straight up.
Yep, that's almost always the answer I get. And my patients, when I ask them that, they look at me like I'm crazy or something. Like, normal? Then I say, well, show me. They're like, well, normal? And then they start worrying. And then they start worrying about, am I doing something wrong here? And then, of course, we always get a laugh out of it. But the way that you should be peeing is not so very prim and proper. We're supposed to act like that in the real world as females, right? No, don't act prim and proper in the bathroom. So basically, you're just going to lean forward like a cowboy, put your elbows right above your kneecaps, and pee. Now, the reason also you want to make sure your feet are flat on the floor because you'll end up not being as relaxed if you're on your tippy toes.
Right.
And what this will then allow is for your bladder contents to empty fully.
So what is it about, it's such a simple adjustment from sitting up straight to slightly leaning forward with your elbows on your knees. So why does it make so much of a difference?
Well, let's see if I can demonstrate it with Tina. So let's see. I'm sitting like this. So I don't know if I will be able to as well. But if you're sitting, right, these are the butt bones, you're sitting. You see where the bladder is here.
I see
and
it.
so you see where the bladder is like this. So, and then the urethra is right over here. So all of this is left like this amount here is left in the bladder because it can't go against gravity to empty.
Oh, because of the way it's tilted.
So as soon as you go this way, then all of it gets to go down the urethra.
Down towards the opening.
Yeah. I don't know how well you can see that, but.
I learned something new.
So does that make sense?
Yeah, no, it really, really does, because
Yeah.
literally, like, it's like a water bottle. If you tilt a water bottle, but don't turn it all the way upside down, like, if you tilt it, some water's gonna stay, but if you fully dump it, it's gonna all come out.
There you go again, explaining it so people can understand.
I'm just trying to make it, like, make sense in my brain. But no, that's awesome. Wow.
Yeah, cool. I'm glad I could
Still
teach you
learning.
something.
I knew it was the angle, but I didn't know it was the angle.
Yeah, and there's
the
another
opening.
one, but this one I can't really demonstrate as well. It's better on animation. So for example, the bowel, you've heard of squatty potty?
Uh-huh.
So that is basically a stool that wraps around the toilet seat and it elevates your feet so that you're basically doing like the caveman did and squatting. So by putting your feet up, you're pretending like you're squatting in the old days. And what happens when you sit up very prim and properly, the portion closer to the exit is getting kinked. There's a sling around the rectum, and it will, in that position, will kink the rectum so that not the entire stool gets evacuated or emptied. And by unkinking it, you do that by elevating your feet up, and therefore you should be able to empty better.
Wow.
And I will tell you that so many patients that have had issues with not, like they'll still have stool there and they're going several times throughout the day, and you know sometimes they'll have smears, right, because they still have stool there, and they say as soon as they got that squatty potty or put something that was similar, they're like, I empty fully. I never have been able to do this. And
That's
it's crazy
amazing.
that
That's
this little thing.
Yeah, it's literally a simple adjustment.
That's what I mean. So many little tiny changes that you can make on your day-to-day habits that are not hard.
Yeah.
And guess what? They're free. Woo! No surgery, medications, or anything like that.
Yeah, and it'll prevent worse issues as well. Okay, so I know you said you need to keep your feet on the ground, but I know there's a lot of
peeing.
for peeing. So I know there's a lot of short ladies. Can a squatty potty also be used
Yes.
for peeing more effectively?
Yeah, so if for example little girls or people that are vertically challenged, yeah, you can, if your feet do not sit flat on the floor when you're sitting on the toilet, then putting something that will allow that your feet are flat.
Right, so like a squatty potty, a little stool,
Little stool, yeah.
books. You
Yeah,
can get creative.
Anything, yeah. Doesn't have to be expensive.
Wow.
So, pretty cool little things.
I can't believe that I learned something new today, even though I have literally been learning, or I thought I knew everything after we've been talking about this for about 6 months, and I was like, I know what I'm doing. And then today I learned something new about the P position and why it works.
Good.
And that goes back to why education is so important, and it never ends pretty much.
Right.
There's
Right.
so much to know.
Yeah, and you know, that's the key, is if we can just provide that for women of all ages, but especially when they're young. Because if you start young, then it's going to be even less likely that you're going to incur a lot of these issues. And the P positions that we talked about, I mean, I just went over one. And
How many are there?
5. Yeah, so and that's one P position out of 5, and this is one of the lessons that I'm going to be providing in a master course that I'm going to be launching soon, and that goes into a lot more detail. And again, it's all the little simple things that really
That no
make a
one
difference.
ever taught you.
Exactly.
And I mean, for me, I'm just like, where else could you get this information?
You just don't. It's not available. So that's what we're on a quest to do.
Change the world. One vagina at a time. Yeah, so what, can you tell me a little bit more about, so what's in it? Is it just stuff from your subspecialty? Are you including, you know, pelvic floor therapist techniques? Like what, there's so much here and there's so much to talk about, so So what is in it, if you want to give us a little sneak peek?
Sure. It's going to be 15 lessons over the course of 5 weeks, so 3 lessons a week. And each lesson has an activity that you will do, and they're fun. Some are more fun than others, but they all have value. There's a purpose in it, and it really gets you into the habit of doing a lot of these different techniques or tips or strategies that you can incorporate easily, actually, in your day-to-day life, so that you don't have to come see me or go to the operating room. Now, included will also be a live Q&A on our private Facebook page. And then we have a little few prizes that come along that you'll be implementing in the courses that I will be teaching. So
that sounds like a lot.
It's a lot, but it's not cumbersome, and they're short for the most part, 20-30 minutes per lesson.
And I've really enjoyed working on it with you, mostly because I feel like for example, if you happen to find somebody who knows the correct pee position, they're not going to necessarily tell you how to do Kegels or how you can modify belly dancing and exercises to support your pelvic floor. But this is so much information that you have compiled based off of 25 years of experience, knowing about this, and it's all in one place, which I think is the key, because you can get bits of information from the internet or from your doctor, but in terms of a comprehensive education that'll really just get you to that baseline where you can really protect yourself and your health. I don't think you can find that anywhere. I haven't been able to find it anywhere else.
No, it really is all comprehensive. And a lot of things that you would have never thought of, like you mentioned, bringing in other types of exercises that help your pelvic floor, not just Kegels, to make it more fun and address other areas in terms of your health.
Yeah,
and overall, keep your vagina young.
And yourself young. I loved there was one lesson about just kind of a little bit more about food. We don't really think about how what we eat or drink affects our bladder, but it affects so much of your bladder, and I drink probably way too much coffee a day, and so just kind of being aware that can have a negative effect on my bladder, I was like, you never know until someone tells you.
Exactly.
So it's really great.
Yeah.
I'm excited, and I appreciate you talking with me today and just sharing a little bit of your vast amount of knowledge. And for you guys who've been here watching with us, I want to go ahead and extend an exclusive offer to y'all. You will be able to get 50% off of the mastermind if you sign up today. We really just want to get this information to you so that you can better protect yourself, and please share whatever you learn with your loved ones, whether it's your girlfriend or mother or grandmother. We can really change the world as long as we make sure to get educated so we can educate others.
Yes. Beautifully stated. Thank you, Taylor, so much, and I appreciate all of your help, not just this talk, but everything that you have done, because it's through the help of Taylor and many others that I'm able to do this, and I'm super thankful.
We got a lot of family in on this project, in case you're wondering. We've got her son as the cameraman, her goddaughter as our social media expert. It's amazing, and it's come really far. So thank you guys so much. See you next time. Woo!
Yay.